Once again, Senator Christopher Bongo, a very big round of applause, everybody. Good afternoon, ladies and gentlemen, to this magnificently splendid day. I am Diane Santos, who is honored to be a part of this momentous activity, and I will be your host for this afternoon. The scent in the air clearly smells of accomplishment, kindness, humanity, and everything valuable and beautiful. Today's event is a triumphant celebration of inaugurating the new and small steps we have taken towards spreading healing and binding our nation as one. Today is the inauguration of the Department of Health One Hospital Command Center as the National Patient Navigation and Referral Center. How about a very big round of applause, please? Thank you very much. And before we formally commence, let's all rise to pray and to sing the Philippine National Anthem.
Mahal na Panginoon, bago ang lahat, nagpapasalamat kami sa mga maraming biyaya na ibinibigay mo sa amin. Humihingi kami sa harapan mo na sana ipapatuloy mo ang mga biyaya sa kasalukuyan naming okasyon. Bendisyonan mo ang mga naghanda para dito sa okasyon na ito para ang mga layunin nila ay makamit. Bendisyonan mo lahat ang mga taong dumalo sa okasyon na ito para maging aktibo sila sa lahat ng aktibidades. Bendisyonan mo rin ang mga mahal namin sa buhay na naiwan sa aming mga tahanan at ilayo mo sila sa panganib. Lahat na ito ay hinihiling namin sa ngalan ni Jesus. Amen.
Thank you very much, everyone. We may now be seated. So, how's everyone doing? We hope all of you are enjoying the weather and the company as much as we do. Please make yourselves comfortable as we are about to start and meet our very important guest speakers for this afternoon. And to start with, without further ado, it is my honor and pleasure to present to all of you for the welcoming remarks, the mastermind and the man with the vision whose 39 years of passion, experience, and skills had led us here today. He is the One Hospital Command Center leader and pioneer, has chaired the country's first health cooperative and the NTF-IATF's COVID-19 treatment czar, Undersecretary of Health, Leopoldo J. Vega. A big round of applause.
Thank you, Diane, for the very kind and generous introduction. Senator Bongo, Congressman Helen Tan, Cabinet Secretary Carlo Nograles, Representative of Executive Secretary Medjaldea, Yusek Ricardo Bernabe, Dr. Rabindra Abie Sanghi, Secretary Delphine Lorenzana, Secretary Carlito Galvez, Secretary or DESPA Rizalina Hustol, Chairman Benjamin Abalos, DICT Representative Yusek Jose Arturo de Castro, Surgeon General Colonel Fatima Navarro, VIP guests, visitors, media, OHCC personnel, and our dear Secretary of Health, Secretary Francisco Duque. Good afternoon to you all. The DOH and Secretary Francisco Duque welcome you in all in the inauguration of the One Hospital Command Center at the Philippine International Convention Center. I remember so vividly last July 2020 how the OHCC began its operations in a tiny room on the fourth floor of the MMDA, Metro Base, with only 2 or 3 individuals going on a 24-hour duty, with nothing but a borrowed equipment to work with, and no matter how the space was so small, meetings still took place. Despite the lack of resources, meals were also served, thanks to the initiative of the Health Emergency and Management Bureau and our host, the MMDA. From that limited space, the MMDA Sports Center was converted as the OHCC new home in August of 2020. Who would have imagined that a basketball court could and would be transformed into an operation center? Fast forward to 2021, and the OHCC has finally settled to where we are standing right now, the Philippine International Convention Center. It will be a year when DOH took the challenge of strengthening the country's health system capacity in responding to the COVID-19 pandemic through the establishment of the One Hospital Command System for health system coordination and referrals. Today, we are on course in fulfilling our objective of streamlining our referral system and optimizing the use of medical care services at the national level for a unified COVID-19 response. Despite the challenges that the OHCC has encountered in its operations, its launching today is a testimony of how much we have accomplished in such a short time. To date, we have developed OHCC core processes such as data analysis, case referrals, and transport provision. Established a system on call-taking management, home care packages, handling prank calls, and Facebook management, to name a few. Launch teleconsultation services in partnership with DOH retained hospitals. Hired additional manpower to complement the surge of COVID-19 cases. Installed additional ICT equipment and software. Developed OHCC Coordinators Handbook. Oriented the centers for health development in different regions regarding OHCC. Facilitated and attended learning and development interventions as an important component of personal development and capacity building. Partnered with different national government agencies, government offices, non-government organizations, and the private sector, and organized internal units and committees to ensure that every aspect of the OHCC's operations is well represented. Therefore, I wish to thank those who have religiously supported this undertaking as a whole of government approach since day one. We couldn't have accomplished such great feats without the assistance and encouragement that we receive from a lot of people. Allow me to express our sincerest gratitude to the following. First, we thank the administration and the Department of Health through the EXICOM for believing that the OHCC will pave the way in transforming healthcare services in the Philippines. Second, we thank our generous and reliable partners who have been with us along the way, enabling our plans and providing the expertise and resources that the OHCC needed to grow and expand. We are eternally grateful to our fellow government agencies and offices, namely the Metro Manila Development Authority, the Basis Conversion and Development Authority, and the Department of Tourism for providing OHCC its initial home in Makati and for continuously catering the needs of hundreds of Filipinos in need of quarantine and isolation facilities through endorsement to Oplan Kalinga hotels and to temporary treatment and monitoring facilities. The Department of National Defense for providing us warm bodies and support. The Department of Foreign Affairs, the Bureau of Quarantine, the Department of Labor and Employment, and the Overseas Workers Welfare Administration for reciprocating the services that we are providing for our returning overseas Filipinos, who we are all aware have been one of the most affected population during this crisis. The Department of Social Welfare and Development for providing technical and financial assistance to our patients in the community and health facilities. The Department of Interior and Local Government for engaging the services of our local government as the frontliners and first responders in the community. The Department of Public Works and Highways and the Department of Transportation for the prompt construction of COVID-19 health facilities such as modular hospitals and portable swabbing booths. The Office of the Vice President through their Bayanihan e-Consulta for augmenting our teleconsultation services and for providing us with COVID-19 care kits. The Office of Senator Grace Poe for the headset and funds for Google Drive expansion. The Office of Senator Amy Marcos for the OHCC's biometrics. The Office of former Senator Bong Marcos for providing us also with care kits. The Department of Information and Communication Technology for equipping us with 1 GPBS, internet connectivity, and storage server in order to enhance our telecommunication capability. The Office of Senator Bongo, the Senate Committee on Health and Demographics for supporting the institutionalization of OHCC as the National Patient Navigation and Referral Center. The Office of Congresswoman Helen Tan for initially filing the proposed bill at the lower house for the National Patient Navigation and Referral Center. We also extend our deepest gratitude to our private sector partners, namely the Philippine College of Emergency Medicine, the University of the Philippines Manila College of Public Health, the Polytechnic University of the Philippines, the Association of Nursing Administrations of the Philippines, and the Data Privacy Commission for providing technical assistance in addressing the learning and development needs of our OHCC personnel. The Philippine Red Cross for ensuring the safety of our OHCC personnel in their timely conduct of RT-PCR testing among our OHCC personnel. PLDT for equipping us with 100 Mbps internet connection, 15 analog lines, and wireless phones. Globe Telecommunication for providing us postpaid phones. Teletech for providing us with technical assistance and headsets. Evolution for providing us with a LED wall. SquidPay for producing the OHCC IDs. The World Health Organization for handing over 20 laptop computers and for strengthening the information and technology capacity and policy development and institutionalizing the OHCC as the National Patient Navigation and Referral Center. The Pure Force and Rescue Corporation for sharing your Pure Force platform ever since this initiative started in 2020 up to this day. Lastly, to the Philippine Disaster Resilience Foundation and its task force, Test, Trace, and Treat, T3, for providing technical support during the start of OHCC and supporting the government's effort to swiftly expand RT-PCR testing and accelerate the country's vaccination program rollout to combat the COVID-19 pandemic. I would not let this opportunity end without recognizing the undying support of the different DOH offices, bureaus, and hospitals involved in the COVID-19 response operations, particularly the following: the Knowledge Management and Information Technology, for providing us with laptops and other ICT equipment, and especially for sharing with us your technical expertise in enhancing our information and technology capacity. The Health Emergency Management Bureau for deploying their workforce in order to provide guidance and technical assistance in the operations of the OHCC. Our DOH retained hospitals for lending us their medical doctors and residents, consultants, as we aim to expand our telemedicine platform. The OHCC would not be what it is today without your generous help. We are very grateful to be sharing this day with all of you, and may we accomplish more in the future. To all our special guests and others who have not been mentioned, please know that you have also been instruments in supporting our growth and inspiring us to go further. Lastly, to our modern-day heroes, the staff of the OHCC, through Dr. Bernadette Velasco, we are forever indebted for your unparalleled service, dedication, and hard work. Without all of you giving your best 24/7 to our patients, the OHCC would not exist and be what it is today. Indeed, we are just beginning. There is much to look forward to, new doors to open, and more paths to build. It is my only hope that we will continuously improve as we aim to provide adequate healthcare services, especially to the poor. It will be harder work going forward, but I am confident that with all of you taking this difficult yet fulfilling road, we can build a better future for our beloved country. And lastly, allow me to emphasize that DOH health outcomes are measured not only by achieving our national targets, but also how our collective efforts and strategies can integrate our fragmented health services for the betterment of every Juan and Juana. Thank you, and good afternoon to you all.
Thank you very much, Yusek Vega. It is really admirable how you always see projects through from conception to completion. Truly, you are a gift to us. And now, to give us an inspirational message, let's all welcome one of the forefronts of the COVID-19 pandemic response. His valuable leadership is truly irreplaceable in terms of the pandemic. With expertise in both health, executive, and management matters, served as head of the PhilHealth, all right, sorry about that. So let's do it again. All right, so with feelings, with expertise in both health, executive, and management matters, served as head of the PhilHealth and the GSIS, and is now on his second time to lead the Department of Health. Please welcome the vibrant, cheerful, and high-spirited Secretary of Health, Francisco Duque III.
Thank you very much, Diane, for the kind words of introduction. To our esteemed guests, led by Senator Christopher Lawrence Bongo, the chairperson of the Senate Committee on Health and Demography, recognized as the father of the Malasakit Center program. Thank you so much, Senator, for passing a landmark piece of legislation. And certainly, this is one vital component of the universal health care. And we salute you for your commitment to uphold the interests of the Filipino people insofar as their health is concerned. You are truly a champion of our people's health. And also joining him is the congressperson of the House of Representatives and also the chairperson of the Committee on Health, one of the pillars of the Universal Healthcare Law. It was under her auspices when this law, a landmark law that was passed through her guidance and for rallying her colleagues in the House of Representatives to give their all-out support for the enactment of this bill. And of course, we have Secretary Charlie Galvez, the vaccine czar, and let's give him also a big round of applause for today. We have jabbed about 13 million Filipinos. And this is, well, not 13 million Filipinos, but 13 million jabs in both first and second inoculations. And we hope to be able to achieve close to 20 million by the end of July. Is that right, Mr. Vaccine Czar, Secretary Galvez? Yeah, so we need everybody's support to be able to achieve the goal of herd immunity, but with the intermediate milestone of achieving population protection in the appropriate geographic settings. And also we have with us Dr. Rabindra Abhiyasinghe, the WHO country representative to the Philippines. He has been a staunch supporter of the DOH manifold pandemic response. And today, he has been instrumental as well in giving our national vaccination program a big push. And thank you, Dr. Rabi, for all the unequivocal support. And then we have the DICT Undersecretary, Attorney Jose Arturo de Castro, who's also working his best to put together the vaccine information management system. Hopefully, this will be the key to an international certification as well as a local authentication process so that our people can traverse to and from the different LGUs, different jurisdictions without having to worry about the authenticity of their vaccination cards, their vaccination status. So good luck to the DICT. You have that work cut out for you. And then, of course, a very dynamic head and chair of the Metro Manila Development Authority, former congressman and former several-term mayor, secretary and chair Benher Abalos. Thank you for being such an effective bridge between the IATF and the local chief executives constituting the NCR and the Metro Manila Development Council. Thank you so much. And of course, to truly an asset to the Department of Health, as was correctly pointed out by Diane, USEC Leopoldo Bong Vega has really been so effective in putting together this one hospital command center. This is, in fact, ladies and gentlemen, just a component of a broader service delivery arm of the universal healthcare, which is the Philippine, this is the National Patient Navigation and Referral Center. That is the umbrella program. And the One Hospital Command Center is just one of its components, okay? And I'd like to thank Yusek Bong for the transformation that he has led over the past several months, and you know, the humble beginnings of the One Hospital Command. It was housed under the kindness of the MMDA when they decided to lend the sports center of MMDA, where the One Hospital Command Center began as a ragtag operations, no? And now you have seen the massive transformation, and to some of you who have not witnessed the grand hospital, One Hospital Command Center, you can see that for yourselves, and you can be the judge of what we mean by the kind of transformation that has been led by none other than our treatment czar, Yusek Bong Vega, and I would like to ask each one of you to give him a big round of applause. Thank you so much, Yusek Bong. Certainly, you are making a difference, not just in the Department of Health, but in the lives of our people and patients, in particular during these most challenging and difficult times. And of course, we have the One Hospital Command System Organizing Committee and staff headed by Dr. Det Velasco. Dr. Det Velasco, tumayo ka nga. Ito talaga, kinukulit namin ito eh. Umaga, hapon, gabi, hindi na ito talaga, minsan nakakausap ko, lumuluha na ang kanyang mga mata. Halos hindi na talaga natutulog. Isa kang bayani, isa kang lingkod bayani na tinitingalaan ng sambayanang Pilipino. Maging maganda ka, pagpatuloy mo ang pagiging modelo mo at magandang halimbawa kung ano ba ang tunay na ibig sabihin ng dedicated, committed public service, at kasama din ng buong tropa mo, Itaas ninyo ang mga kamay ninyo para makita kayo. Tumayo naman kayo because, these are the real heroes, no? These are the real frontliners. Sila yung nabubugbog sa telepono, binubugbog ng katakot-takot ng mga kritisismo. Pero, they just do their jobs, as passionately, without any complaint whatsoever, no? And they're the ones, they're really the pillars of the pandemic response. And that's why I take this opportunity, Mr. Senator, Mr. Congresswoman, and my colleagues in the executive branch, that, there are no words to describe the heroism that they have demonstrated. And, I think this country is hopeful that we will succeed our fight against this pandemic because, again, they are the testament to what we believe will be an unequivocal victory of all against COVID-19, of course, under the leadership of our beloved President Rodrigo Roa Duterte. Palakpakan naman natin para marinig ni Pangulong Duterte ang lahat po ng ginagawa ng kanya pong mga ahensya at ang sakripisyo na kanila pong ipinamamalas para lamang matagumpayan natin ang laban sa COVID-19. At ang ating pong mga kumakatawan sa iba't ibang mga ahensya ng pamahalaan. Ang mga kasama ko sa Department of Health, ang EXICOM, ang lahat ng mga sisipag na mga opisyal ng DOH-EXICOM, at ang ating pong mga kababayan, friends, ladies and gentlemen, again, I convey to you most healthy and historic afternoon. Today, we mark another milestone in the advancement of the Philippine health system as we now officially launch the new One Hospital Command Center that will be housed here at the Philippine International Convention Center. And of course, the COVID-19, as you all very well know, has obligated us to reduce face-to-face exposure, minimize surges of patients to higher level facilities, and increase utilization of primary care facilities and provide immediate and convenient solutions to patients' referral requests. Hence, we established this One Hospital Command System in line with our universal healthcare mandate and universal healthcare to ensure that every Filipino is healthy, protected from health hazards and risks, and has access to affordable, quality, and readily available health services suitable to their needs. But of course, before I continue on, my apologies. I'd like to acknowledge also my co-chair of the Interagency Task Force. Pasensya na po, ako'y kinakabahan, nakakalimutan kong maalala yung mga pangalan ng mga kasama ko. Of course, napakamasipag and dynamic co-chair of the IATF, CABSEC, Carlo Nograles. Let's give him a big round of applause. And also Sec. Del Lorenzana of the Department of National Defense for his unwavering support to the IATF. And he has been quite material and instrumental in many of our programs within the IATF, and more importantly, in putting together the policies and the resolutions that have made it easier for all of our implementing units to do their job as efficiently and effectively. Ladies and gentlemen, we have seen how the OHCS helped in breaking through social and structural barriers to create efficient referral systems. This significantly helped in the avoidance of the cumulative delays in care seeking, diagnosis, and referral to appropriate health facilities. Truly, the OHCS has been of immense value in redefining and reforming the nature of the health delivery system of the Philippines towards equity, accessibility, and quality. Today, as we inaugurate a newer, bigger command center, it is our fervent hope that we continue improving from our previous best in the delivery of healthcare services. And let us continue to work hand in hand in making our health system and capacity more responsive and more accessible to every Filipino, especially to the marginalized in the impoverished areas. Of course, we also like to thank all those who worked tirelessly for the realization of this Inauguration Day. Your efforts will have an enormous impact in the improvement of the lives of every Juan and Juana. On this note, I convey once again our warmest and deepest congratulations to all. Maraming salamat po at muli magandang araw.
All right. Thank you very much, Sec Duque. Kami po ay na-starstruck din. At nagagalik din po kami sa inyong pagkilala sa aming serbisyo. Maraming salamat po. OHCC has been all about building fruitful connections. Building connections with our patients, our partners, different institutions and agencies, and people from all walks of life with different skills and expertise. These connections have enabled us to reach goals we couldn't have imagined to achieve. As such, we know the value of connections, collaborations, and progression. The next two speakers will tell us more about it. To give us a glimpse of building collaboration, we are lucky to have with us today an economist and the Deputy Chief Implementer of the National Action Plan against COVID-19. He is the current President and CEO of the Basis Conversion and Development Authority. Please welcome the skillful and very hardworking Secretary Vivencio Vince Dizon.
Thank you very much po. Magandang hapon po. Senator Bong, Sec Duque, CabSec, Sec Charlie, my boss, also my other boss, Sec Del, and our partner po, Chairman Benher of MMDA, Congresswoman Helen. Thank you very much for being here. Sec Bong and all of our government officials and partners from the private sector, and also Doc Rabi of WHO. Thank you so much for being here today. Alam niyo po, 1 year ago, or maybe more than a year ago already, Sec Bong, we set up the One Hospital Command in a basketball court. No, kaya matutuwa po si Senator Bong kasi paborito po niya ang basketball. We set it up in a basketball court hosted by the Metro Manila Development Authority. Napakaliit lang po. Siguro, mas maliit pa, siguro kalahati lang ng lugar na to, Doc Det. No? And it was graciously offered by then MMDA Chairman Danny Lim, who unfortunately are one of the key government officials that we have lost to this terrible pandemic. Naalala ko pa, Sec Bong, Sec Pinkoy, na binuksan natin yon. No? It was at the time when we were surging in NCR. No, right after the first surge of March and April. No, it was sometime in May of last year. And it was really envisioned as a way for us to be able to triage patients efficiently. No, and it was a great idea launched by Sec Bong Vega, our then very newly appointed treatment czar, together with T3, our private sector partners, no, and together with all the other hospitals in Metro Manila. However, because of the unpredictability and the insidiousness of this virus, we found it very hard to cope with the upcoming surges in August and then our most recent surge in April and May of this year. That's why 2 months ago po, Sec Bong, Sec Charlie,
Sec Del and Sec Ed Año said that we need to dramatically upgrade the one hospital command. And actually not just make it a one hospital command based on the guidance of Secretary Duque, but make it into the National Patient Navigation and Referral Center. No, that will not just refer to hospitals, but also refer to the various quarantine and isolation facilities all over the country. No, and we met here 2 months ago, and I just want to thank, is Attorney Padilla here? Attorney Padilla is here, of course. Attorney Padilla, thank you very much, Opo, for hosting us that day. And I think from that day forward, we really worked together in collaboration to really make this happen. As you will witness later on, it is much improved from that very small command center that was built in the basketball court of MMDA. But it's important to note that while we have moved out of MMDA, we want to thank Chairman Benher Abalos and the entire MMDA. Kasi po, MMDA pa rin po ang tumatao dito sa ating COVID Referral Center. Kaya maraming salamat po, Chairman Benher. We also want to thank the private sector. From the very beginning with our hospitals. I see Dr. Sami Ang from Chinese Gen. Alam niyo po, there was a time, araw-araw po sila umaga nagmi-meeting nila Yusek Bong. No, lalo na nung kasagsagan ng surge. Nandun po lagi si Doc Sami Ang ng Chinese Gen and iba pang mga ospital natin. So the private sector hospitals and our government hospitals, DOH hospitals, local government hospitals have always been here with us to help us navigate through this very difficult and challenging time. We also want to thank our technical partners, Pure Force, who was with us from the very start, and also the other associations of our BPOs who have also supported us through the Test, Trace, and Treat consortium. So it just shows po na yung panawagan po ng ating mahal na Pangulo na kailangan magsama-sama tayo, magtulungan tayo hanggat finally matalo natin ang COVID-19 ay buhay na buhay pa. And for that, we are all eternally grateful to everyone. Again, maraming salamat po sa inyong suporta. And I hope, God willing, hindi naman kakailanganing gamitin ito at hindi na tayo dadaan sa bagong surge. Pero kung umabot man tayo doon, at least po, Yusek Bong, Sec Pingoy, Senator Bong, CABSEC, Sec Charlie, Sec Del, ready po tayo. Maraming salamat po at God bless po.
Maraming salamat din po. And now, to discuss the connecting health facilities, we have with us someone with a heart for public service. He is the former Assistant Secretary for Legislative Affairs of the Department of Justice with expertise in law and technology. Let's call on Attorney Jose Arturo de Castro, Undersecretary of the ICT.
Magandang hapon po. Senator Christopher Bongo, sir. Congresswoman Helen T.L. Tan, IATF Chair and Health Secretary Francisco Duque III, sir. IATF Co-Chair Cabinet Secretary Carlo Nograles. NTF Chief Implementer Secretary Carlito Galvez. NTF Deputy Chief Implementer Secretary Vince Dizon. Defense Secretary Delphine Lorenzana. MMDA Chair Secretary Ben Abalos. And Dr. Ravindra Abesing, World Health Organization representative. Distinguished guests, our partners from the government, fellow public servants, speakers, friends, ladies and gentlemen, a good day to you all. It is my privilege to attend this auspicious event on behalf of your DICT Secretary, Gregorio Gringo Onasan, to deliver his message on connecting health facilities. So today, we inaugurate the One Hospital Command Center, or OHCC, and we at your DICT would like to congratulate all the hardworking public servants who have helped establish it as the National Patient Navigation and Referral Center for the country. During this pandemic, the OHCC is serving as the government's referral network, linking all health service providers, our hospitals, quarantine facilities, and medical transports in order for them to quickly connect our people who are in need of medical attention. The OHCC was envisioned to help provide patients with faster access to medical services and to assist in relieving the burden on the healthcare system by ensuring that cases are referred to appropriate healthcare facilities with available beds, while also ensuring efficiency in addressing the increasing demand for medical assistance and intervention. With OHCC playing a central coordinating role, COVID-19 patients are guided in seeking medical care for severe and critical cases, as well as on home care protocols for mild cases. In addition, our country's non-COVID patients are also given a chance to access quality routine healthcare services through the teleconsultations being offered by OHCC. It is therefore crucial that we strengthen and support the OHCC as it facilitates better access to medical and financial resources with its linkages through the Malasakit centers under Honorable Senator Bongo's Malasakit program and the other medical assistance programs of our various healthcare institutions. With the passage of Republic Act 11223, or the Universal Healthcare Act, the Philippines has taken a significant step towards a stronger and more resilient healthcare system. The government's efforts to connect all healthcare facilities through this mechanism and the OHCC will be a critical enabler to help ensure the successful implementation of universal healthcare. President Rodrigo Roa Duterte's marching orders for your DICT is to provide connectivity, connect government to other governments, domestic or global, government to businesses, government to its citizens, and everybody to each other. And we must do this faster, cheaper, if not free, and in a more secure manner. Your DICT takes this to heart as it pursues its own programs and participates in the various interagency initiatives, all in support of the whole of government's COVID-19 response. Kindly allow me to take this opportunity to share with you your DICT support for the OHCC, primarily by connecting health facilities through the power of information and communications technology. Your DICT's Free Wi-Fi for All program seeks to improve every Filipino's access to the internet and the countless opportunities it brings wherever they may be located in the country. And even before the pandemic, your DICT has worked tirelessly to intensify its efforts to meet the increased connectivity demands of the public. With internet connectivity playing a key role in COVID-19 response, for the government offices and local government units, your DICT recalibrated and enhanced its rollout strategy for free Wi-Fi to reach more and more people, especially in the remote regions, including the geographically isolated and disadvantaged areas, or GIDA sites. And to date, with its ramped-up efforts, your DICT has installed more than 10,000 free Wi-Fi sites across the country. Through the government's commitment to provide Wi-Fi, we aim to enable our countrymen, even the ones in the farthest GIDA sites, to communicate and get in touch with the OHCC and avail of its services. Your DICT also activated free Wi-Fi access points at government health facilities, quarantine facilities, and vaccination centers nationwide. These include, among others, the quarantine facilities in Rizal Memorial Coliseum, the Dagupan City Astrodome, Ateneo de Zamboanga, as well as the COVID-19 testing centers such as San Lazaro Hospital, the Lung Center of the Philippines, and Western Visayas Medical Center, among others. Communication through free internet access has enabled and allowed better coordination between health facilities and the OHCC. It has also been a source of relief for patients under investigation and persons under monitoring, who now have the means to communicate with and see their family, friends, and loved ones during periods of confinement and quarantine. Your DICT is also overseeing the operation of the Vaccine Information Management System to serve as the key processing and analytics system for COVID-19 immunization administration and vaccine supply chain management in the country. The VIMS is comprised of the Immunization Registry, or VIMS-IR, for master listing and pre-registration, and the DICT Vaccination Administration System, or DVAS, for the Directory of Vaccine Recipients. The VIMS will help show the number of administered vaccines by region, generate comparative reports between our country's vaccination efforts and those of our Southeast Asian neighbors, and track the government's vaccine supply and distribution. We see the collection of this data as being instrumental in the implementation of the Philippine National Deployment and Vaccination Plan. So once more, we wish to congratulate the IATF, the NTF, and all the public and private sector partners, agencies, supporters who have contributed as we inaugurate the OHCC as the National Patient Navigation and Referral Center. Please be rest assured that your DICT will continue to find ways to support and reinforce your endeavors. Your DICT remains a strong partner in the healthcare sector's efforts in ensuring better efficiency in the delivery of services by improving the connections between and among healthcare facilities in the country. Together, let us strive to achieve our vision of a more inclusive, more resilient, and more sustainable digital future for everyone. Maraming salamat po at magandang hapon po.
Thank you very much, Attorney. All right, and now, let us take some time to listen to what our cabinet secretaries have to say. Let us start off with the Presidential Advisor on the peace process since 2018, a retired Philippine Army General, and is the Chief Implementer of the National Task Force Against COVID-19. Help me welcome Secretary Carlito Galvez Jr., a big round of applause. All right, let's have again, the excitement continues, all right, because we are filled with very important people and we are lucky to be sharing their presence today. Up next, I'm sure women have been waiting for his piece because this is a lawyer by profession and is also the co-chair of the Interagency Task Force for the Management of Emerging Infectious Diseases in the Philippine government's response to the COVID-19 pandemic. He previously served as the representative of Davao City's 1st District from 2010 to 2018. He was also the chairman of the government's Interagency Task Force on Zero Hunger. Let us all welcome the charming Secretary Carlo Alexi Nograles. A big round of applause.
Maraming salamat, Dayan, for the kind introduction. I'll keep it short. Una sa lahat, binabati ko ang pinaka-masipag na senador sa Republika ng Pilipinas, action man himself, kung ang buhat ang mo'y pasultion, daghan na nasulti kini, kay daghan na iyang gibuhat. We're very proud to have Senator Christopher Bongo, the Chair of Health ng Senado. Palakpakan po natin, the father of the Malasakit Centers. Salamat kayo, Senator. Ang classmate ko sa Kongreso, timing na timing siya ang chair ng health din sa Congress kasi doktora. And well, very good response also. Thank you for everything that you do sa Congress. Our chair sa Committee on Health sa House of Representatives, Dr. Helen Tan. Mga kasamahan ko sa gabinete, of course, we are led by none other than Executive Secretary Medialdea, who is represented here by Yusek Bernabe and Despa Hustol, who are here. And of course, the chair ng IATF, Secretary Duque, our mga partners po natin ang chief implementer natin, and Vaccine Czar, si Secretary Charlie, and of course, the National Task Force Commander, Secretary Del Lorenzana. And then, of course, DICT, represented by Undersecretary Brady De Castro, my classmate in law school, and MMDA Chair, Abalos, and all of the other hardworking men and women in government, friends from the media. I'd also like to greet, siyempre, itong lahat na ito ay nangyari dahil kay Yusek Bong Vega. Yusek Bong, thank you very much for everything that you do. Palakpakan natin. And of course, WHO, Dr. Abi, thank you for always guiding us. 3 points lamang, no? First of all, as we look through the different facilities that we have here sa ating One Hospital Command, ang una kong sinabi ay siguradong matutuwa si Pangulong Duterte dito. Dahil nung siya po ay mayor ng Davao City, ang talagang pinagmamalaki talaga ni Mayor Rody Duterte mula noon hanggang ngayon ay ang ating 911 Command Center. At timing na nandito si Senator Bongo at si Yusek Bong Vega dahil memorize nila yung 911 Command Center natin sa Davao City. At kung ano yung nakita natin sa 911, ni-level up natin, and now we have this One Hospital Command. Alam na alam ni Yusek Bong yan because he was the head of SPMC. And most of the referrals pagdating ng magkasakit, may maaksidente at lahat sa Davao City, diretso yan sa SPMC. Si Senator Bong naman sa Davao City, memorize siya yung 911. Lahat, everything that's needed in terms of criminality, anti-crime, deterrence natin sa hospital, aksidente, name it, lahat po yan sa 911. At we're very happy to see that it has now become a nationwide center in this OH One Hospital Command Center. No? Matutuwa rin si Pangulong Duterte dito dahil nabanggit na ng ating mga kasamahan ang tungkol dito sa OHCC. But one thing na added feature na gusto ko lang din pong idiin is that this is not only a patient referral system, it's not only a way for us to bring ambulances to those who are sick and bring those who are sick into the proper hospitals, but it also integrates the Malasakit Center into this one-stop shop. Si Senator Bongo po, siya talaga yung father of Malasakit Center, gaya ng sinabi ni Secretary Duque. Ano po? And we have now leveled up again the Malasakit Center by integrating this into our OHCC. Napakalaking bagay po niyan because the Malasakit Center really is at the end of the whole process. It's one thing to bring the patient to the hospital. It's another thing to get medical attention to the patient. But at the end of the day, yung pagbayad po nung lahat ng kailangan bayaran sa hospital, is also at the end of the whole process. At hindi natin matatapos yung proseso hanggat hindi maramdaman ng ating mga kababayan ang malasakit ng gobyerno sa pamamagitan ng pag-shoulder natin ng kanilang medical expenses. And none other than Senator Bongo, again from our experience in Davao City, siya po ang nagdala ng Malasakit Center sa lahat ng regions, and right now we shall be integrating that as well to the one hospital command. So muli, Senator Bong, maraming salamat sa mga malasakit centers mo at ang malasakit mo para sa taong bayan. Second po, timing lang din, nandito si Chair ng Committee on Health ng Senate at Chair ng Committee on Health sa House of Representatives, because this is one project na hindi natin pwedeng iwanan na ganito lamang. We must institutionalize this whole program, because pandemics might become a normal situation, not only not in this country but the entire world. We don't know where this pandemic will lead us with the variants going around. Hindi natin alam. But one thing is for sure, what happened with COVID-19 has accelerated our need for better health care in the Philippines. I'm very happy that meron tayong universal health care coverage under the term of President Duterte. Now, we have this OHCC, a patient referral system, which we want to bring in all regions. Institutionalizing it is the next step. Tamang-tama po, pagkatapos ng State of the Nation address ni Pangulo, which I hope he will be able to showcase this and announce this in his State of the Nation address. But after the SONA is the budget. And I hope that we can see a budget to institutionalize this or begin the institutionalization process of this, but more so a law that will make this a permanent fixture in our healthcare system. And third and finally, I hope that as we move towards the end of the administration of President Duterte, I hope that the next administration will continue what we have started. This one is one of the many projects and programs under the Duterte administration, and we hope that the next administration will see fit to continue on with this very important program. No? What we want to see is a level up of healthcare service, at gaya ng binabanggit ni Yusek Bong Vega, it's not just patient referrals all over the country. It's not just taking patients and bringing them to the proper hospital, but it's many other things. Data analysis, malasakit, looking at the data for us to be able to prove the management of all our hospitals nationwide, and it also includes telemedicine, which also includes mental health care. I think this is something na minsan nakakalimutan natin, but the pandemic has showed us all that mental health care really of our people, of Filipinos, is something that we must really put a focus on. And I'm very happy that this one hospital command center does just that. It's teleconsulting, telemedicine, and it includes taking care of the mental health of our people. So there are just so many features that we can improve even more, but it must not stop. It must continue from this administration to the next administration. So again, congratulations to everyone. Thank you all for all of your hard work, and we shall continue to battle COVID-19 together and all other diseases here in this country. And I look forward to better, brighter future ahead for all of our people, and a better Christmas, of course. Maraming salamat at magandang hapon po muli.
Thank you very much, Sir Carlo. Ayan. Marami daw pong magpapa-autograph mamaya. Baka daw po pwede. All right. And now, to move forward, it is my honor and pleasure to introduce to you, to further expound the early development of this momentous event and to show us what the OHCC is all about, let me call on the very hard-working operations manager of the One Hospital Command Center, Dr. Bernadette Velasco. A round of applause, please.
Thank you, Diane. The Department of Health and the IATF on Emerging Infectious Diseases, in coordination with the ILG, DOT, MMDA, and BCDA, officially launched the One Hospital Command Center last August 6, 2020. The Command Center facilitated a comprehensive and coordinated response to the COVID-19 pandemic, and it boasts of ensuring effective and efficient health facility referral within and outside Metro Manila. And due to its enormous success, we are very pleased to present to you that we are already at the PICC due to the unwavering support of the government that have helped us to have grown bigger and stronger, with a full force of 24/7 service, ready to help the Filipino people anywhere they may be. And now, I am with utmost confidence to reveal to all of you the video presentation of the Department of Health One Hospital Command Center.
Indra Abeyasinghe.
Magandang hapon. Honorable Christopher Lawrence Bongo, Senator, Chair of the Senate Health Committee. Honorable Helen Tan, Congresswoman, Chair of the Congressional Committee on Health. Honorable Francisco T. Duque III, Secretary of Health and IATF Chair. Honorable Carlo Nograles, Co-Chair of the IATF, Cabinet Secretary. Secretary Delphine Lorenzana, Secretary Carlito Galvez, Vaccines Secretary Vince Dison, Chairman Benjamin Abalos from the MMDA, Undersecretary Jose de Castro from the ICT, honorable colleagues from DOH and other affiliated government agencies, friends, this is a very significant and important occasion, and WHO is very pleased, and I am privileged to be here. We today celebrate the vital work of the One Hospital Command Center that was established on the 6th of August last year to coordinate the referrals between the COVID-19 pandemic, particularly when the surges started happening. The One Hospital Command System, or the OHCC, has addressed the need for a mechanism to navigate patients across the spectrum of essential care required during the health emergencies and this pandemic. The establishment is a laudable initiative by the Department of Health and the Philippine government in its pandemic response. Optimizing the care pathway based on disease severity and local context is essential to increase the efficiency of subnational health systems and to best utilize limited resources, both through appropriate referral and back referral. These measures are globally recognized as best practices and have no doubt contributed to saving many lives. The One Hospital Command Center started to facilitate teleconsultation, patient referral, and medical transport assistance for those who need urgent care in Metro Manila. It has been instrumental in monitoring and providing near real-time data on available staffed beds for hospital, facilitating early and appropriate referral, minimizing queues for admissions at hospitals. Eventually, One Hospital Command Center has extended its much-needed support to other regions. It was critical for local government units to be guided in appropriate referral systems and rational utilization of healthcare facilities. As WHO, we have been supporting the OHCC since its inception in 2020, and I have been fortunate to personally get to know Undersecretary Leopoldo Vega. We helped strengthen its information technology capacity as well as its policy development in institutionalizing it as a national patient navigation and referral center. Today, the OHCC is being inaugurated as the country's national patient navigation and referral center. This is a critical step towards the building of a resilient healthcare system. This is what WHO has envisaged through the COVID-19 pandemic response. Yes, we want a response to the pandemic that will help minimize the loss of lives and help minimize the damage to the economy. But we also view the response as a critical component to building a resilient health system that will eventually cater to the establishment of a universal healthcare system in the country. And this is one of those steps in the right direction towards that goal. As it is, the OHCC has significantly improved its operations, responding effectively during surges in NCR and more recently in other regions. We envision the center has a long-term solution to link patients and healthcare facilities to improve better outcomes. With this, the One Hospital Command Center can learn from lessons during this pandemic response to keep improving its systems and efforts with the ultimate goal of strengthening and widening access of patients to telehealth services without delays and guide them across the healthcare system. This is indeed a step in preparing for the new normal. It's a way of rationally using resources and expanding universal healthcare. This will be a breakthrough in the implementation of universal healthcare in the country as we transition from pandemic response to building back better, stronger universal healthcare systems in the country. I would like to take this opportunity to thank each one of the growing 150 strong staff at the OHCC, headed by Dr. Bernadette Velasco as Operations Manager, its medical and non-medical staff, coordinators, call takers, and the management led by Undersecretary Leopoldo Boyga. You have helped thousands of patients and their families navigate a health crisis, and you continue to do so on a daily basis, 24/7. We commend your dedication and commitment. WHO remains committed to provide assistance and support the National Patient Navigation and Referral Center and the Department of Health in the national COVID-19 response. Congratulations to every one of you who has made this day a possibility. Thank you.
Thank you very much, Dr. Rabi. And now, to introduce our first guest of honor, let me call on the very energetic Director of Metro Manila Center for Health Development, Director Gloria Global Balboa.
Okay, thank you, Diane. To our distinguished guests and to all the attendees in this very important event, isang malusog at ligtas na hapon po sa ating lahat. Well, it is my honor and privilege to introduce to you one of our guests of honor and speakers in this inauguration of the One Hospital Command Center as the National Patient Navigation and Referral Center. She is a prolific and dynamic lady legislator who is known as a staunch advocate of public health, being both a nurse and a doctor. Her legislative agenda includes reforms in the health sector and the provision of essential social services for the Filipinos, such as education and livelihood. Among the most notable legislations to her credit include, of course, the Universal Healthcare Act, the mandatory PhilHealth coverage for all senior citizens, the mandatory PhilHealth coverage for all persons with disabilities, the Universal Access to Quality Tertiary Education Act, and the Go Negosyo Act. She is an indefatigable public servant who envisions a progressive district with reliable services and empowered citizenry based on the agenda of healing, which means health, education, agriculture, livelihood, infrastructure, nature and environment, and good governance through her brand of service, popularly known as Serbisyong Tunay at Natural. She is the current chairperson of the Committee on Health of the House of Representatives and the co-chairman of both the Asia Pacific and the Philippine TB Caucus. She was a 2015 Outstanding Filipino Achiever and a recipient of the 2014 Outstanding Congressman Award. Well, she is also our #1 supporter and sponsor of the institutionalization of the emergency medical services system, for which the One Hospital Command Center can be a part or can be a link to the entire system of the emergency medical service. So ladies and gentlemen, let's give a big round of applause to Honorable Angelita Helen Tan, representative of the 4th District of Quezon.
Maraming salamat po kay Director Balboa sa napakagandang pagpapakilala. Magandang hapon po sa inyong lahat. Hayaan niyo po ako na batiin muna ang ating mga katuwang sa paglilingkod. Siyempre sa ating pong partner no, sa Senado sa pagsusulong ng mga makabuluhan at napakahalagang health legislations, no? Katulad po ng Malasakit Center Act kay Senator Bongo, Secretary Duque, na palagian ko pong nakukulit sa maraming paglilinaw ng mga polisiya, Secretary Vince Dizon, syempre sa atin pong the brainchild of One Hospital Command Center, Yusek Vega, Yusek De Castro of the ICT, kay Chairman Abalos, Dr. Rabi from WHO, sa atin pong mga cabinet secretaries, kay CABSEC Carlo na nakasama ko po sa Kongreso, napakasipag din, Secretary Galvez, Secretary Lorenzana, at sa lahat po ng ating mga bisita ngayong hapon. I am honored to join all of you on this historic inauguration of the One Hospital Command Center as the National Patient Navigation and Referral Center System, or Referral System. Having heard the welcome remarks, of course, of Yusek Vega and the inspirational message of our Secretary Duque, along with the expositions of Secretary Dizon and Yusek De Castro, and the key message of Dr. Rabi, and of course, a message from our CABSEC, Secretary Carlo Nograles, parang wala na po ako masasabi. But allow me, as a principal author of House Bill 9633, or the National Patient Navigation and Referral System Act, to build on the earlier points raised by our speakers. Magbalik tanaw lang po ako, first of all, if you recall, yung Universal Healthcare Law provided for the integration of services into healthcare provider network, because we are not only an archipelagic country, we are also an archipelagic health system, which is mixed. We have the private, the public, where most of those in the public health facilities are devolved. And this fragmentation does not help the cause of ending dichotomy between the primary and tertiary care. So to transition from the specialty care to primary care, the Universal Healthcare Law provides for the healthcare provider networks. For example, on population base, we have the DOH who shall contract the province-wide and city-wide health systems. And on the other hand, we have the PhilHealth who shall contract the public, the private, or mixed healthcare provider networks for the delivery of an individual-based health services. Whether population-based or individual-based health services, a primary care provider network is a must. It refers to a coordinated group of public, private, or mixed primary care providers as the foundation of the healthcare provider network. The primary care provider network shall provide primary care services and shall serve as the initial contact and navigator to guide patients' decision-making for cost-efficient and appropriate levels of care and coordinate patients to facilitate two-way referrals and remove barriers to health services. Also enable patients' record to be accessible throughout the health system and implement public health services. But the thing is, we have a complex system of healthcare providers that may result into a high out-of-pocket expense, hospital crowding, overloaded specialists, and at times, patients being overtreated. Hence, the integration of services into healthcare provider network is highly necessary. And with the primary care provider network serving as the initial contact and navigator to guide patients' decision-making for cost-efficient and appropriate levels of care, the UHC law ensures that patients will not get lost in the jungle of our health system. Let me point out, however, and this is the second and last point I would like to make, that this design under the UHC law has created what we call unintended policy consequences that spawned the creations of islands of health systems, departmentalization, or what we sometimes call as silos. While such is inevitable given the country's political and institutional setup, it is significant to bridge that gap by creating an integrated system among these healthcare provider networks or even the LGUs and administrative regions, an idea that is worth pondering in the face of COVID-19 pandemic. And I think that is the essence of one hospital command center that we are now inaugurating as the National Patient Navigation and Referral System, and which is being strengthened and expanded under House Bill 9633 through the establishment of the Integrated Patient Navigation and Referral System that should provide a coherent and seamless linkages among relevant health facilities and agencies throughout the country. The National Patient Navigation and Referral System seeks to support, strengthens, and facilitate the provision of health services of primary care providers acting as navigator, coordinator, and initial and continuing point of contact in the healthcare delivery system pursuant to RA 11223. So nakakatuwa po yung nagawa ng One Hospital Command Center. We thought when we were crafting the UHC law, that would be enough, no? And with the pandemic, we've realized that with the enactment of UHC, hindi siya talaga yung totally that will fix our health system. So we've come to realize marami pang mga kailangang itulak na panukala para paigtingin pa yung ating health systems. And one of this is the institutionalization of this current program. And during our conversation with Yusek Vega, I asked him, is this for COVID only, or should we continue this as a program, no, aligned with UHC? And he said, yes, ma'am, that's what we envision in the future. So, nandun po yung suporta ko, no, sa bilang chairperson of the Committee on Health in Congress upang itulak ang pag-institutionalize nitong program na ito. At I'm sure ang akin pong kapartner at nakakatuwa naman dahil napakabilis ng aming mga naitutulak sa Kongreso at napakaganda ng nagagawa, no? Sana, no, with the I think less than a year na natitira namin dito. Ako personally, I'm on my last term, no? But marami naman pong doktor sa Kongreso, so marami pa po kayo magiging katuwang. So, congratulations to the DOH family headed by Secretary Duque, kay Yusek Bong Vega, of course kay Dr. Det Velasco. Tama yung sinabi ni Secretary Duque that Dr. Det has been a partner since 2016, no? When I started, I think, in Congress for pushing the institutionalization of emergency medical services System Act, no? I passed it already in Congress, no, last Congress, and then we passed it now sa Committee on Health. And hopefully, maipasa din po natin ito para maging isang batas. So, ang One Hospital Command Center bilang ating National Patient Navigation and Referral System ay isang napakalaking hakbang sa pag-abot sa bawat Pilipino ng serbisyong pangkalusugan na mas higit na kailangan ngayon ng mamamayan, especially with the pandemic. So congratulations po sa inyong lahat at magandang hapon po.
Maraming salamat po, Congresswoman Helen Tan. And of course, we would also like to thank our media partners who is with us this afternoon. Also the PCOO or the Presidential Communications Operations Office for helping us disseminate the visions and the efforts of the DOH and the national government. How about a big round of applause din po sa kanila? Maraming salamat. Now, to introduce our next guest of honor, she is the Assistant Secretary of the Office of the Chief of Staff and the Health Regulation Team. Let's call on Attorney Charade Mercado Grande. A big round of applause.
Isang magandang hapon po sa inyong lahat. Isa pong karangalang ipakilala ang ating guest of honor sa hapon na ito. Our next speaker served President Duterte for more than 21 years. He is a simple man from the province like the President. He began his career in public service in 1998 as the executive assistant of then Congressman Rodrigo Duterte. He became his most trusted aide until Mayor Duterte was catapulted into the presidency. Loyal, honest, and hardworking. As former special assistant to the President, he served as the bridge of the people to the President. He is an all-around action man working hard to ensure that all directives of the President are implemented. As a senator, he was the author or sponsor of 9 out of 14 Senate bills which passed into law in the 18th Congress. As the chair of the Committee of the Senate on Health, he was the principal author of Malasakit Centers Act. He also championed other legislative measures aimed at improving our healthcare system. He also championed the passage of Bayanihan to Heal as One Act and the Bayanihan to Recover as One Act, which help businesses and citizens alike to stay afloat and survive during the most critical time of COVID-19 pandemic. As the chair of the Senate Committee on Sports, he authored the National Academy of Sports Act, which gives the country's most promising student athletes with a quality secondary education while also helping them train in sports. He was also the principal author of Republic Act 11462, which postponed the Sangguniang Kabataan and barangay elections to give local officials more time to finish their projects and to save valuable funds. He also authored the Salary Standardization Law 5 that raised the salaries of all government employees, including public nurses and teachers. He also co-authored and co-sponsored 6 other bills passed by Congress, such as the Organic Agriculture Act, Alternative Learning System Act, and Doktor para sa Bayan Act, among others. As he continues his work in the Senate and 18th Congress, he now carries with him the banner of Tapang at Malasakit and is championing a government that truly cares for the people in order to provide them with a Duterte brand of public service. Let us please welcome our hardworking Senator, Christopher Lawrence Bongo.
Thank you for the courtesy. Pasensya na, sabi ng coach ko, maglagay daw ako ng taas para daw mas makita raw sa TV. Pero mukha, pangit tingnan to, masyadong mataas. Anyway, Dr. Rabindra Abeya Singha, representative to the Philippines from World Health Organization. Maraming salamat po for guiding us from the very start in this fight against COVID-19. Secretary Francisco Duque, IATF Chairman and Secretary of Health, Sir, maraming, isa-isahin ko na lang po, ito na yung pagkakataon na mapasalamatan ko rin po kayong lahat. Salamat sa iyong sakripisyo. Hayaan mo muna yung mga bumabatikos as long as you have the President's trust and confidence. Importante munang malampasan muna natin itong pandemyang ito. Mamaya na yung pagsisisihan. And of course, Secretary Delphine Lorenzana, NTF Chair, sa iyong sakripisyo para sa lahat ng mga OFWs, including sa ating, for leading the military. And of course, Secretary Carlito Galvez, Vaccine Czar, na walang kapaguran at 24/7. Kwento ko na lang po sa inyo, alam mo, tao lang tayo eh. Talagang aabot rin yung panahon na maubos yung pasensya natin. At si Secretary Galvez, very soft-spoken, napakahaba ng pasensya, pero aabot rin ang panahon na talagang mapapagod na rin po siya. Pero marami pong mga insidente na ako na lang po nagpapagitna kay Secretary Galvez. Nagko-conference call po kami. Ayoko na po pangalanan. Siyempre, sir, intindihin po natin yung mga politiko. They want to serve their constituents rin po. And they want to please their constituents. Ayaw rin nilang pumalpak sila doon. Kaya umiinit po talaga ang ulo sa kanilang mga lugar. So ilang beses na po ako nagpagitna kay Secretary Galvez na, sir, sabi ko, habaan na lang natin ang ating pasensya para naman po to sa kapakanan ng ating mga kababayan. At talagang napaka-cool po nito ni Secretary Galvez at pinagbigyan naman tayo. Salamat, Secretary Galvez. And of course, ang taga Davao rin po, ang inyong IATF Vice Chair, Secretary Carlo Nograles. Ito po, silent worker lang po ito. Tatrabaho lang po at the background. Pero nagdi-deliver po. Salamat, Secretary Carlo Nograles. At ito pong energetic na testing czar, napakasipag, kahit saan lang ito umaabot. Gusto ko lang pong pasalamatan itong taong to, kahit na wala na pong ayos, yung buhok, pati yung pananamit. Pero pagdating po sa trabaho, talagang maayos po at nagdi-deliver po. Salamat, Secretary Vince. Papasalamat rin po ako sa inyo. Mula po ito rin po kay Pangulong Duterte dahil nakikita niya po na talagang nagtatrabaho po kayo. And of course, ang ating brains nitong One Hospital Center, kilalang-kilala niyo naman po ito. Talagang pinakiusapan po siya ni Pangulong Duterte. From retirement, sabi niya, huwag ka munang mag-retire, tulungan mo muna ako dito. At alam naman natin na ano yung ginawa niya sa Davao noon, sa 911, hanggang sa SPMC po. Napakaganda, kompleto na po yung hospital. Andiyan na po yung mga cancer center, lahat, heart center. Napakalinis po. May sistema talaga. At nagpapasalamat kami ni Pangulong Duterte na dinala niya po yung kanyang talent dito sa Maynila. At talaga pong nakakatulong naman po. Salamat, Yusek Leopoldo Vega. Sir, salamat po. And of course, ang aking counterparts as a lower house, lahat naman po ng pinapadala niya sa akin sa Senado ay sinisikap ko pong maipasa kahit na talagang dumadaan po ako sa butas ng karayom sa Senado. At sabi ko naman kay Ma'am Helen, basta kapakanan po ng mahihirap ay ipaglalaban ko po ito. Kahit na isang linggo tayong magdebate dyan, kahit talo ako sa debate dahil baguhan lang po ako sa Senado. Pero sabi ko, basta kapakanan po ng mahihirap nating kababayan, yung mga taong walang matakbuhan, yung mga helpless at hopeless, ipaglalaban ko po yun hanggang sa huling, kahit na gabi. Anyway, speaking of my job as a senator, marami pong nagtataka, bakit kasama ka ni Pangulong Duterte? I will not limit myself just to being a legislator. Ang trabaho po ng isang senador ay legislation, constituency, and representation. Sa totoo lang po, 7 days a week, ilang oras lang kami, ilang araw lang kami nagsisesyon. Meron pong 4 na araw na wala namang kaming ginagawa. So bakit hindi ko iukol ito sa mga kababayan natin na ngailangan po ng tulong at serbisyo natin? Nagsasabi lang po ako ng totoo sa inyo. At nangako po ako kay Pangulong Duterte, nasasamahan ko po siya habang buhay. Hindi lang po sa trabaho. Alam niyo, tayong mga Bisaya, utang na loob, wag dili kalimtan. Yung utang na loob po, utang na loob ko sa tao. Hindi lang po doon sa personal na bagay. Nangako ko sa kanya, sasamahan ko siya sa mga personal niya ng bagay. At sa trabaho naman po, iisa lang aming layunin ni Pangulong Duterte. Magserbisyo lang po. At isa po ang natutunan ko sa kanya na sana po ay maibahagi ko sa inyo. Let me share it with you. Ang pinapaalala lang niya sa akin, just do what is right. Just do what is right at unahin mo ang kapakanan ng iyong kapwa Pilipino. Hindi ka magkakamali. Yun lang parati niya pinapaalala sa akin. Alam mo, pag meron siyang ina-appoint sa gobyerno, even Secretary Galvez, tinatawag pa nga niyang, Sir, ganito. Gawin mo lang yung tama, Sir. Hindi ako makikialam paano mo dadalhin yan, Secretary Duque. And even Secretary Benhur Abalos. Nung in-appoint niya po early this year, si Secretary Abalos. At Sir, hindi nagkakamali si Pangulong Duterte sa pag-appoint sa iyo dahil talagang kabisado mo na po yung Metro Manila. At nung nagkataon na nagkaroon tayo ng surge dito sa Metro Manila, nandiyan ka po sa gitna nila, nakita mo yung problema, at finally po, hopefully, ma-stabilize po natin with the continuing vaccination rollout po natin, ay tuloy-tuloy po itong ma-stabilize natin. Ibig sabihin, balancing between economy and health. Kami naman po ni Pangulong Duterte, inuuna po namin ang buhay ng Pilipino. Ang pera naman po ay ating kikitain. Subalit yung perang kikitain natin ay hindi po nabibili ang buhay. So, buhay pa rin po ang unahin natin. Sir, salamat sa tulong mo po kay Pangulong Duterte, lalo na po sa panahon ngayon, Secretary Benhur Abalos. Of course, isa-isahin ko rin pong pasalamatan, Deputy Executive Secretary for Finance and Admin, Rizalina Hustol from Davao po ito, silent worker lang po ito. Palakpakan po natin. Ayan, tumutulong rin po ito kasama sila ni Yusek Vega rin po. Salamat, ma'am. And Undersecretary Arturo De Castro, Undersecretary Roger Tong-an ng DOH, Undersecretary Mirna Kabutahe ng DOH, Undersecretary Rico Bernabe ng Office of the Executive Secretary, ASEC Girly Veloso ng OP, ASEC Romeo Ong ng DOH, ASEC Maria Francia Laksamana ng DOH, ASEC Elmer Punsala ng DOH, ASEC Sharade Grande Mercado ng DOH, and of course, ma'am, na-introduce na kita kanina, no? So, salamat kay Congresswoman Helen Tan ng 4th District, Director Gloria Balboa ng DOH, Director Ronald Lau ng DOH, Director Maria Paz Corrales ng DOH, Director Angelina Del Mundo ng DOH, Director Enrique Tayag ng DOH, President Jojo Sulaiman ng Pure Group of Companies. Palakpakan rin po natin sa inyong tulong. And classmate po ito ni Pangulong Duterte, inyong General Manager po ng PICC, si Renato Padilla. Sir, salamat po sa pagpagamit rito. At least komportable na po ang ating mga operators. Colonel Fatima Navarro ng Surgeon General, Mr. Ray and J.R. Langit, salamat po sa inyo, sa lahat ng tumulong dito. Distinguished colleagues, our dear frontliners and guests, bago ko po malimutan, ito pong pinaka-importante sa lahat po ng frontliners, lahat, utility workers, medical frontliners po, even janitors po ng mga hospital, maraming salamat po sa inyong sakripisyo sa panahon ngayon. Palakpakan po natin ang ating mga frontliners. Ako naman, dito lang po ako sa likod. Bilang Committee Chair on Health, dito lang po ako sa likod. Tatrabaho lang po ako. Dahil kita niyo po yung mga nakaraang buwan, yung mga nurses natin na gusto na nilang mag-examine, kailangan pong makapag-examine na kaagad. Kaya lang hindi po bakunado yung mga PRC examiners. Nakiusap po tayo kay Secretary Galvez, Secretary Duque, nakapag-examine na kaagad sila. Para po makapag-duty na rin sila. Dahil marami pong mga nurses natin na gusto na pong magserbisyo rin po. Kaya lang po, medyo napopostpone po yung kanilang mga examination schedule. At ako naman po, nandito lang ako sa likod. Kung may mga reklamo ho kayo, lalong-lalo na po yung delays po ng mga benefits, delays po ng ibibigay, I'm here to fight for you sa mga frontliners. Nung nakaraang taon po, nagsalita ako, pasensya na po, pero hindi po katanggap-tanggap namin sa amin ni Pangulong Duterte, lalong-lalo na po yung mga namamatay nating frontliners, kasi hindi na po talaga nababayaran ang buhay ng bawat Pilipino. Nagsalita po ako, yung iba po suspendido na at nanagot na po sa kanilang pagkukulang. Anyway, moving forward, it is an honor to join you today for the inauguration of the One Hospital Command Center as the National Patient Navigation Referral Center. This marks another milestone on the government's relentless efforts in providing fast, efficient, and unified COVID-19 response. I congratulate the Department of Health for this initiative, which aims to streamline the processes for health facilities and healthcare provider networks to be more coordinated in the referral and transfer of patients. Witness po ako dyan dahil nung mga nakaraang first few months po nitong COVID-19 pandemic, marami pong nananawagan, tumatawag, saan ba sila magpapa-admit? Meron pang isang insidente dyan, from Nueva Ecija, umabot na lang po sila ng 8 hospital at nakakalungkot po, namatay po yung pasyente. Kawawa naman po. Ngayon, meron na tayong isang command center na nakatutok po sa kanila. At ako naman po bilang committee chair, nag-usap na po kami ni Ma'am Helen, na pinag-aaralan ko po itong, meron po silang ini-endorso, the institutionalization of the National Patient Navigation and Referral System. Ito pong function nito is assist patients having difficulty finding and reaching health facilities, answer queries on health services, provides teleconsultations, coordinate patients needing financial assistance. So, pinag-aaralan po namin ito. It's maybe long shot. Pero as a start po ay bilang committee chair, pag-aaralan ko na po ito. Kung ano po yung makatulong sa ating mga kababayan na mapabilis yung serbisyo. At sa lahat po ng mga OHCC operators, meron lang po akong paalala sa inyong lahat. Please extend your patience. Not extend the number of patients. Alam mo, trabaho naman po natin yan, nahabaan nyo po ang inyong pasyensya. Kahit murahin na po kayo dyan sa telepono, pakiusap lang po namin ni Pangulong Duterte, pagbigyan nyo na po, habaan nyo ang ating pasensya dahil trabaho naman po natin yan at bayad po tayo dito sa gobyerno para magserbisyo po sa kanila. Anyway, I congratulate the IATF mo sa ating COVID response. Even the World Health Organization has acknowledged the OHCC for the important work it is doing in coordinating health referrals during this pandemic po. So, bago pa man ang pandemya, dumating pa po ang another na pandemya, pakiusap ko lang po sa inyo, magtulungan lang po tayo. On my part, I will continue to ensure that the health and safety of the Filipino people remains a top priority. Bago pa man ang pandemya, talagang nakakaawa ang ating sitwasyon. Kaya nabanggit ko po kanina na ipaglalaban ko po yung mga hospital bills sa Senado. Based on my experience, dahil bumababa po ako sa mga hospital, even as far as Hulo and Basilan po, meron tayong mga malasakit centers doon. Nakita ko yung sitwasyon. Minsan po, umaabot sa 400% occupancy rate. Paano po gagaling ang pasyente? Nakahilera dyan, isang kama, 2 pasyente, 3 pasyente. The more we should invest sa ating healthcare system right now. And I also commend yung sa ating IATF sa pagdadagdag po ng mga modular hospitals dahil bawat minuto po na nasasayang natin, buhay rin po ang nakataya dyan. And speaking of malasakit center, sisingit ko na lang po sa inyo, so far with the help of my colleagues in the Senate and the lower house, I was able to sponsor and push for the passage of 24 local hospital laws. Just recently, President Duterte approved 13 of these local hospital laws that will increase bed capacities of hospitals and establish new hospitals in the provinces. At ako naman po, ang una kong naging batas at pinaglaban ko po sa Senado, itong Malasakit Centers Act of 2019 with the help of Congresswoman Tan. Ano po ba ang Malasakit Center? Natutunan ko po ito kay Pangulong Duterte. Matagal po akong nasa tabi niya for 23 years. At nakita ko po yung puso niya sa mahirap. Marami pong lumalapit sa Davao. Alam po ni Yusek Vega yan. Pupunta po yan ng City Hall. Mga taga Zamboanga, taga Surigao, taga Jensan. May hawak po sila na hospital bill. Hihingi po sila ng tulong kay Mayor Duterte. At sinasabi ng COA, bawal po gamitin yung pera ng Davao City sa hindi residente ng Davao City. Which is legally true siguro po. Kaya lang po, nakita ko yung puso ni Mayor Duterte. Sabi niya, ito yung hospital bill. Tinapon niya sa akin. Sabi niya, Bong, kung hindi ko matulungan itong mga taga Zamboanga, mga taga Surigao, hindi na ako uupo dito sa City Hall bukas. Hindi ko matiis na tumanggi sa kanila dahil para sa akin, Pilipino rin ang mga yan. Doon po nag-umpisa yung Malasakit Center. Nung naging presidente siya, sabi ko, ano bang pwede nating bilisan nating serbisyo? So pinakiusapan ko po yung PhilHealth, DOH, DSWD, and PCSO. Doon po sa Cebu. Sinubukan namin, nilagay namin sa isang kwarto lang po ng hospital. Pinagtatabi namin yung representative nila. It became successful. More than 300,000 patients lang po sa Cebu ang natulungan. Nung unang panahon po, Lunes, pipila po yan sa City Hall. Martes, pipila po yan sa PCSO. Madaling araw pa lang, magmamakaawa. Miyerkules, DOH, Huwebes, PhilHealth, and finally po, DSWD. Ubos yung panahon nila, ubos pa yung pamasahe sa kakapila. Sabi ko, bakit natin pahirapan yung pasyente? Sa totoo lang po, pera nila yan. Ibalik po natin sa kanila yung pera nila. Ba't pa natin pahirapan? So doon po nag-umpisa ang Malasakit Center. Nung naging senador po ako, pinaglaban ko, pinirmahan ni Pangulong Duterte, naging batas na po siya. Ngayon po, meron na ho tayong 128 Malasakit Centers. Para po yan sa poor and indigent patients at wala pong pinipili yan. Basta Pilipino ka, karapatan mo yan. Sabi ko nga sa mga pasyente, kung hindi ka tulungan ng Malasakit Center, pagalitan mo, sabihin mo, hoy, Pilipino ako, karapatan ko yan. Inyo naman talaga yan. Anyway, rest assured po, nandito lang po ako na magtatrabaho po para sa inyo. Anytime po, kung meron kayong mga pasyente, may mga kailangan kayo, tutulong po ako sa inyo. Congratulate lahat ng, wag na lang po tayong wag na lang muna nating ipagmalaki ngayon yung mga accomplishment. So far, the Philippines is doing a good job in our COVID-19 response. Ayon po sa WHO, based sa ating kakayahan at kapasidad bilang isang middle income country, sa ating pagbabayanihan at pagkakaisa, malalagpasan din po natin itong krisis na ito. Kami po ni Pangulong Duterte ay patuloy na sumusuporta sa mga programa at inisyatibong naglalayong mapabilis at mapagaan ang pagproseso ng mga medical-related cases. Mamaya na po tayo magmalaki at kung mayroon man tayong ipagmamamalaki, gawin na lang natin pag natapos na po natin itong krisis na ating kinakaharap. Ang importante ngayon ay kung paano natin mapagaan ang buhay ng bawat Pilipino. This National Patient Navigation and Referral Center is a testament that the government has never stopped in finding solutions to the many problems brought about by this crisis and continues to work towards providing our people with more comfortable lives. I am hoping for the continued success of OHCC, or now the NPNRC. May you fulfill the expected duties and responsibilities to provide accurate, effective, and efficient healthcare services. Sa mga bumabatikos, kesa po magsisisihan tayo, wala naman pong may tutulong. Mabuti pong magtulungan na lang po tayo. Sino ba namang magtutulungan kung hindi tayo lang po, kapwa nating Pilipino, upang malampasan po natin itong krisis na ating kinakaharap sa ngayon. Once again, congratulations to everyone on the inauguration of the NPNRC at mabuhay po kayong lahat. At let me remind everybody, lalong-lalo na po yung mga government workers, aside from extending your patience po dito, tandaan po natin, minsan lang po tayo dadaan sa mundong ito. Kung ano pong kabutihan o tulong na pwede natin gawin sa ating kapwa-tao, ay gawin na po natin ngayon dahil hindi na tayo babalik sa mundong ito. Kami po ni Pangulong Duterte ay patuloy hong magsiserbisyo sa inyong lahat. Para sa amin, ang serbisyo po sa tao, kayo po yun, ay serbisyo po yan sa Diyos. Maraming salamat. Magandang hapon po sa inyo lahat. Okay, nakalimutan kong i-introduce si Sermon Liboro. Palakpakan rin po natin, National Privacy Commission. And si Ma'am Dayan, salamat rin po. Ma'am, very familiar po yung pangalan nyo sa session namin sa Senado. Parati kang nababanggit doon. Meron rin po si Dayan. Sa nakikinig natin. Narinig mo ba si Dayan? Palakpakan rin natin si Dayan.
Maraming salamat po, Senator Bongo. Ayan, baka pwede po kaming mag-selfie mamaya. Ayan. Again po, bilang frontliner, kami po ay nagpapasalamat sa inyong paalala sa amin bilang government public servants. At maraming salamat din po sa pagkilala sa kadakilaan lang lahat ng frontliners. Alright, and last but not the least, for the closing remarks, he is known to have a distinguished career in the government service, having served for 15 years as City Mayor of Mandaluyong, and is also known for his industrial and commercial development. Let us all welcome Chairman Benjamin Abalos Jr., MMDA.
Maraming salamat, Dayan. Of course, sa aking iniidolo, no? Talagang he's the epitome of malasakit and para lang sa alam po ninyo lahat, our family owes him a lot. If not for him and sila Sec Vince, nag-aagaw buhay po ang aking mga magulang noon. And he was very instrumental with our president. We owe him. Talagang mapalad po kami at nandiyan po kayo. No? The epitome of a true public servant, Senator Bongo. And of course, naging kadikit ko na rin si Secretary, halos every Zoom ng Zoom eh. Kaya kabisado ko na kung nakapajama siya, kung naka-Amerikana siya. Ha? Talagang, pero yung boses niya, ganun pa rin kaklaro eh. Ha? And of course, talagang tama po si Senator, talagang napakabait yung tao, napakasipag, no? Dapat malaman po ng lahat yun. At ang kapartner niya, si Secretary Galvez, ganun din. Hindi nagbabago yung buhok. Maski, alam ko wala na rin tulog. At si Sec Vince, tama rin po si Sec. Talagang napakasisipag po. And of course, our silent worker, si Sec Nograles sa IATF, talagang nandiyan po siya parate. And of course, very gentleman, talagang makisig, si Secretary Delphine Lorenzana. Ma'am Helen, ang ganda ng mga insights nyo. Ang ganda po ng kalagayan ng ating kalusugan basta nandiyan kayo ni Secretary ni Senator Bong about institutionalizing. And of course, I've seen him in action nung sa MMDA. Talagang he's a visionary, he's a worker. And talagang he wants everything in systems, Yusek Leopoldo Vega. Congratulations, sir. Dr. Ravi, I've read what you said about our country, about our response to the COVID. Thank you so much for those kind and truthful words. No? Talagang nagpapasalamat. Talagang I shared that statement of yours to all my friends. No? It is a testament to the hard work of all of this here in government. No? Maraming salamat po. And of course, Yusek Castro and all of those mga Yusek po nandito po ngayon. Ladies and gentlemen, magandang hapon po. Yesterday, we had a meeting with all of the mayors of Metro Manila. One of the issues was about the 5-year-old going out. And the second issue, the most important, is about our preparation for the Delta variant. So a lot has been discussed. Number one, we have to inventory our manpower, review our triage system, and of course, massive testing and monitoring of cases, and to make sure if there's such a slight surge in one street, in one barangay, automatic granular lockdowns, testing isolations. It's hard to be complacent nowadays. It's very hard. I got a call from Secretary Duque about this. And one of the things that's very important is this one hospital command. This is very important. Hindi mahirap mabulunan sa mga ospital sa nakita natin. That is why, Yusek Vega, I would like to congratulate you. Like during the peak, imagine, with just 67 call takers, on the average, kasi kapitbahay lang namin, nakikita ko they have about 400 to 500 calls a day. and the workers are there 24 hours, walang tulog, walang pahinga. So you could just imagine these things. But at this point, they've already perfected it. And so, I'm very sure, maski dumating ang Delta variant, handa po ang lahat dito. No? In ending, I would like to congratulate everyone dahil so far in Metro Manila, in the whole country, in Metro Manila, this was the surge the last time. Talaga napakataas ngayon, halos napakababa, everything is down, ang luwang ng kaso, even the jobs. Congratulations, Secretary Charlie, talaga salamat. We've hit about 5.6 million jobs. And not only that, we're doing 107,000 on the average every day, and that's about 3.2 million for July, August, September. You add that up, and that will be more than 14 million jobs. Meaning, if we have a population of 14 million people in Metro, more than one half, we hope more than one half, will have to have 2 doses. We will have population protection by the end of September. And that will be indeed a very happy, well, that will leave a happy note for everyone. In ending, ito lang gusto ko sabihin, you know, once they found this table on the Great Plains of Mesopotamia, and in it was written that civilization is founded on 4 pillars. The learnings of the wise, intelligence. The courage of the brave, tapang. The justice of the wise, justicia. And the last is the prayers of the good. In it, it was written that civilizations are found on those 4 pillars. But it lacks one thing. It is the unity of all the people who've woven this civilization together. At sino yun? Tayong lahat yun. Kaya napakalaki nitong One Hospital Command. Ito ang magtatahi ng lahat. Magandang hapon po sa inyo lahat.
Maraming salamat po. All right. Again, thank you so much for all our media partners and the PCOO or the Presidential Communications Operations Office for being with us from start till finish to envision the efforts of the DOH and our national government. All right, so again, I think we are ready for the ribbon cutting. But before that, can we have a social distancing pictorial? Ayan, pwede po ba tayong mag-pictorial? Ayan. Let's have our photographers to assist us with our social distancing group picture. Ayan, pwede po ba tayong mag-assist sa harap?